Uh, it's great being with you doctors today, and I'd like to ask you some questions about what it's like to work with Beacon. You know, Beacon's been providing behavioral health for over 25 years. We're expanding our network of adding physicians, and what's worked well for you all with Beacon and
One of the things that I've loved the most is partnering with Beacon has allowed me to unload a lot of the administrative tasks that have been associated with having a solo individual practice, and I get more time to focus on patients and being a doctor, and less time on the other stuff that I didn't go to business school or law school. I went to med school so I could take care of patients and be a doctor, and I get more time to do that now, and I'm just very grateful that we have the support of a network like Beacon to help us out with those things.
And another interesting thing about Beacon is our group of colleagues is really fun to work with. We have kind of a great bunch of eclectic psychiatrists that offer different services, and it makes it easy for us to add services that we didn't have before, because we have a colleague we can call at any given time and ask them, what did you do in this situation? How did you handle this situation? So this Beacon locker room is probably one of the biggest perks too.
yeah, I've always enjoyed coming to the physician advisory board meetings and having the best of the best in the room together, and you all sharing your ideas, and just seeing the fruits of that, of where it takes us, and just think there's just big things ahead.
And that's one of the neat things about the Beacon model is you've got all of these individual providers who have forged our own pathways into building our practices, and we've all gone kind of down a different path in different ways. And now when we get, like you said, Fozzie, getting in the room with everybody and hearing how you're tackling this type of problem, and learning about, your expertise in Spravato, and just the sharing of ideas is just really helpful, in knowing that it's being like part of a team again,
Yeah.
and it's a great feeling. So
That's a good point, because we've got doctors who are great at doing TMS, like you, Dr. Earthman, and just know it, have breathed it, and just can talk about a TMS machine and all the different types of TMS machines. And then we got Dr. Rush, who's just fabulous at Spravato. He knows Spravato up and down, from the clinical to even the billing side of it, and he's willing to go on site to our practices, and he came and met with Fozzie and helped Fozzie with his Spravato, and that's what it's all about, is doctors being able to help other doctors, and Beacon's just our 25 years of just supporting practices, just staying out of you all's way, letting you all maintain your clinical identity,